Hi everyone, and welcome to Life After Corona, a conversation between concerned citizens and the elephant. Today I'll be speaking to Wanjiru Gikonyo. Wanjiru Gikonyo is the team lead and national coordinator of the Institute of Social Accountability. But I just like to ask you how you're doing, how is your family, and importantly, how are you guys coping with this new normal?
We're well. Thankfully, we are well. Haven't had any corona incident. Of course, it was scary at first, but we've now come to adjust and to get into action to kind of assist where we can, especially in my line of work, or in my calling. I don't know if advocacy is a line of work. It's more of a calling because you do it all the time. But we're well. I'm fine with the new normal. In fact, I'm wondering, I'm one of those people who will probably, really considering if I need to get back into the office or just show up for targeted meetings, because this is so efficient. There is no time lost traveling. And it just shows how inefficient our whole process is. And I hope we will keep the best of what we've learned. But of course, then there are the issues we're going to discuss today. Corona has been, you can look at it in two ways, big scare pandemic, but also, we seem to have dodged the bullet somewhat in not getting the kind of scope of infection that other countries have had. So it's the lessons that come out of that, because this could have been very hairy, and we're not out of it yet. But when you see, what we've seen in Italy, in Spain, we're not seeing it as much in America because of the expanse of America. But America and the UK are also very badly hit. Had we gotten that kind of load, the body bags that were imported for China would not have been enough. So in a sense, there's a kind of sense of relief, but also I think just thinking, are we going to change? Are we going to respond to this? Are we going to rise to it? So it's a good time to reflect and to just do things better.
Okay. Speaking of reflections, I'd like to just get started on your first reflection, being someone in the advocacy and the civic society. How the backdrop of how civic actors and civic liberties have fared in this time of Corona globally, in particular.
Yeah, of course, when you have a big pandemic, in the interest of the public good, it's expected that civic liberties, some liberties, may be suspended. And so we've seen suspension of freedom of movement. We've seen increased surveillance that can, you're talking about your right to privacy. We've given up some of that. And there's concerns, of course, that maybe what we've given up may become the normal, which is, I think the issue of privacy and data and technology, that's a very touchy area. So on one hand, you expect to give up rights, but then on the other hand, government needs to respect, dignity is inherent. That is not negotiable. Issues of equality, valuing life. And the response, for instance, in this country, government has fared much better than would have been expected, because our government, was doing reggae, really responsible management of the economy and, high octane politics at the expense of serious policy. But they've been managed to kind of pull a decent response together, in my view. But on human rights, they fared poorly. And I believe if we had a kind of a stronger justice system, the kind of justice system our constitution anticipates, there would be cases and will be cases because people were infected because of government negligence, herding people together, in quarantine, hiding them as they boarded the ferry, you know. So human rights were not respected. And the issue of data protection, right to privacy, also is a conversation civil society has been trying to push that has not yet, government has not yet really acknowledged as an issue. So pandemic, you expect a response, all actors come on board, all hands on deck, but there have been excesses. I think globally we've seen different regimes responding in a manner that betrays or demonstrates their respect for human rights. So you've had extremes. I mean, China, I think, was possibly an example of the lack of civic culture, the culture of openness, because the Chinese government made the decision to withhold this information for possibly 4 or 5 weeks longer than they needed to. And the first scientist who discovered it was then vilified and eventually actually died from it because he was targeted by the administration. So in a very real sense, I think COVID has shown that civic liberties are important for livelihoods and for the protection of life at a very basic. And governments that don't respect civic liberties are more likely then to cause, you know, really, bring about catastrophe on their population. So and then, you know, that has been playing out in different extremes. Now, I think the good thing COVID has done with regard to civic liberties is it's brought about a conversation that, because obviously we've been operating in a neoliberal setup where big business, big development infrastructure is really the way a lot of governments view the way to develop, especially on the continent. And COVID has just come through and said, forget it. You have to invest in civic liberties, you have to invest in human rights, you have to invest in people, you have to invest in your health system at the very basic. So I think COVID has really exposed the soft underbelly of autocratic regimes. And then you'll find countries like Sweden. I think on the continent, we've had Ghana that's done very well. We've had South Africa. There have been some excesses in South Africa, but, you know, more, you know, for the most part, they've also done very well, very good communication, very upfront communication. In cases where some of the, you know, constituencies felt aggrieved, they've even gone to court during COVID and been able to sue government and say, no, you can't do this. So in Malawi, I understand the court actually ruled against the shutdown. So we've seen differences, and I think COVID has shaken things up. And for civil society, it's an opportunity for us to really get back into the conversation and say, no, it's not all about putting money in infrastructure projects. Development is about really human development, and it's based on a democratic framework, and we need to push for that. Yeah.
I mean, you've thanks for that broad insight. I'd like us now to bring it here in Kenya, because some of the work you do at TISA around accountability, transparency. Also, just I like your views on how Kenyan government in particular has fared concerning accountability, exercising civil liberties. We have seen police brutality. But I don't know if there are any other good lights, but I'd like your views about how GOK has fared in this regard.
Yeah, GOK has fared, like I say, I think what they've done well is they got the right person to communicate. When they got, you know, the CS. And the CS has been credible, believable, really raising the legitimacy of the response, because this government has a huge legitimacy deficit, because it uses a lot of spin, and the spin is really lies when you say it. Yeah, it means that you say you spend 40 billion shillings on the COVID response, and then immediately Kenyans will, there'll be an outcry. But because there's nothing we can do, beyond, we can go to court, we can complain, we can go on social media, and this government ignores that. They imagine they've gotten away with it. But the cost to them really is the issue of legitimacy. And of course, you have to remember, this administration was, in the minds of half of the country, did not win the 2017 election. So already they came in with a legitimacy deficit. From 2013 to 2017 to their own conduct, run a big corruption scandals, they don't come clean, So this legitimacy deficit is a real challenge, because then when they say people should self-isolate or should, wear masks, Kenyans don't take it seriously. So you have parts of the population that say, these guys are just lying, they want money. Why would, any sensible person not believe what government is saying, other than the fact that there's really very low trust? So back to the point, this administration has squandered all its goodwill because it has mismanaged the economy, run us into debt, it hasn't invested in our basic infrastructure, and it's been violating the constitution and violating human rights. Unfortunately, it's continued to violate human rights. We live in the suburbs. We are, for me to encounter the police means that I've really violated the COVID requirements. But in the informal settlements, we are hearing harrowing stories of people being harassed by police when they leave their house to go to the washrooms, which are not within the house. Maybe it's an outhouse, a shared outhouse, and you're harassed by police. We, of course, know that 83% of Kenyans are in the informal sector, and majority of those, vast majority of Kenyans, live, you call it hand to mouth. What you earn today is what you eat today, with very little savings. So when you put in a curfew, and people are used to selling at a certain time, then you have to be sensitive to that. So how has government fared? They fared better than expected, given that, I digressed a bit, so I'll come back to your question. They fared better than expected. They have had good communication. I think they did a lot to try and get the health response in place. But if you compare our response with that of Ghana, for instance, Ghana, within 2 weeks, the testing was widespread and it was moving. We have taken a very, very long time to turn around this failed system. So government has done pretty well under very bad circumstances, but they created the bad circumstances. They haven't invested in healthcare. They haven't invested in primary healthcare. They've been underfunding health, underfunding the national hospital, underfunding research, depleting food reserves, depleting emergency funds, and a lot of corruption around those. So we've been lucky, and that's why I say we dodged a bullet. Had we had a full load of corona, and I pray we're not getting a second wave, that for whatever reason we got a lighter load, the transmission is not as viral as it is in some of the Western countries. Had we gotten that, we were not equipped, Joe, at any level to respond. Not in our culture. The people saying, this thing is just government trying to make money, and people escaping from quarantine. How does that happen? You've been quarantined, and I imagine the circumstances must be, it must be very boring, and maybe you're in a very, kind of very inhospitable place. But escaping from quarantine in numbers. You know, where does that happen? And then somebody records you. You know, so that shows our civic culture is really at a very low ebb. So there's no sense of responsibility of the person who was escaping, or the person who was photographing them, or the people who will then harbor them. So under these circumstances, government has fared well, but they fared poorly. They've tried in terms of disclosures. You know, we were very, you know, you're saying, talking about the kind of money that's needed for this response, and we're seeing this is a gravy train, because there are people who know how to redirect this kind of money. So they put up a web portal, but government doesn't listen, because our request as civil society was, you have to itemize where the money is coming from, what has come in, and where it's going. Not give us a figure of 40 billion. That is not transparency. So this government still doesn't listen to the requirements of transparency. And I call it witchcraft, because they expect, you know, there's a war on corruption on one hand, and then there's lack of transparency. There's no auditor general, and somehow you expect that we are going to fight corruption. That can only be witchcraft. So we don't have the transparency that we need. The last thing I would say is the president constituted a board to coordinate response and the COVID fund. And this board was drawn entirely from private sector. And now this is the biggest weakness of this administration. Well, maybe not biggest weakness, it's a significant weakness, because their biggest weakness, I think, is they have many weaknesses. They don't comply with the law. But when you sit around the table to respond to a national pandemic and you only have one perspective, that just shows you don't understand development. Because development is about everybody. In fact, you should have had the informal traders representative there. Much as, you know, you might say there's, you know, let me not get into the politics of informal trade representatives, because there's quite a lot of politics in that. Informal trade representatives should be around the table to say, this is what my people are saying, this is where it's hurting. How would Matiangi know what it's like to, you know, trade in you know, an informal stall and make some good decision? And we don't have that kind of research and data. There should have been civil society around the table, so we can bring the social perspective, the human rights perspective. An institution like LSK should have been there as well. Again, human rights and legal perspective. So when you have government that only listens to itself and only listens to people who think like it, who are thinking about, let's get the economy running again, there's a risk. And the risk that we see is exclusion, that whatever solutions they come up with will benefit those who are around the table and exclude the majority who are not around the table.
I mean, speaking of exclusion, now as we go into inclusion, there have been numerous reports, I mean, from many counties, you know, Makueni, we saw some of it in Bomet, in Kakamega, about how county governments have actually responded better as pertaining to human development than the national government, national government. So what does then this say moving forward about, one, intergovernmental relations between the county, the national government, and two, the space for devolved units, health being a function of devolution, and how do we strengthen it? And what does all this say about devolution?
Yeah, one, it says that good leadership is necessary for a good response. And you know, kudos to those leaders and who have given us hope, made us proud, and really pushed forward the cause of devolution, because devolution is under attack with this administration. This administration does not believe in, does not support devolution, and they've done, you know, from lack of funding, you know, regressive legislation, very many you know, hostile actions towards devolution, to undermine devolution. So yeah, so what does it say? the primary purpose of devolution is, in our context, one of the key issues was inclusion, because we had centralized government, and centralized spending of resources. And so we had parts of this country that didn't know government. You know, they used to say, yeah, that common saying, they say, ukienda Kenya, if you're up in Turkana or somewhere, your services were actually being delivered by the church, not by government. So government, and you know, even for us, and I keep saying this, if you look at our health service provision, government has been delivering about 40% of health service provision. The rest is delivered by faith-based organizations and private institutions. And government still only pays for about 40-50% of health service provision. So actually we have a government that overtaxes us, violates our human rights, and we still then pay for the services that they're supposed to provide for us. So, you know, there's that you know, that contradiction in our governance. So devolution was supposed to redress this by bringing government closer to the people, by allowing resources to come closer and decision-making to come closer. And it's anticipated. The moment it comes closer, a governor will not get away with ignoring the needs of his citizens or her citizens, because she's closer to the people. And the architecture in the constitution and the devolution laws provides for that. So if the counties that got progressive governors have seen the growth, and what counties do, in fact, counties spend about 60% of the shareable revenue on health. You know, some of the county, 60 might be high, because the highest would be maybe around 50, and the lowest maybe around 25%. So they spend a huge amount of the shareable revenue on health, and they spend it on health. Some of them will be building county level hospitals, but they also equipped the lower level facilities. So they have been doing this despite the fact that there's been a underfunding of county services. So what this tells us is devolution needs more money. Counties need more money for health. There needs to be more spending at the lowest level. And of course, you need to invest in research. You need to invest in the referral hospitals. But there's been a huge tug of war to re-centralize health service provision. And it has started. If you look at the BBI recommendations, they want to re-centralize the management of personnel. Now, devolution has three main, the achieving inclusion and equity in resource distribution comes through main powers: political power, administrative power, and the financial. So political is our governor, our MCAs, they have the power to make laws for us. Administrative is they then have the power to hire and fire so that they can ensure staff are accountable. And then of course, economic is, the financial is they have the money to be able to implement the projects that citizens propose to counties through the public participation process. So this is devolution. So if you say we're going to give you health, but we are going to re-centralize the personnel so that the personnel will sit at the national government level, you're then emasculating governance, because if that doctor misbehaves, the government will go through a long chain to discipline that doctor. And I remember prior, at the outset, before the county started, the CRA gave us an anecdote where they said they went to, I think it was either Meru, Embu, or Kirinyaga County. And actually it was just after devolution had started. And the governor was saying he had on his payroll 8 doctors. But when he did the head count, he could only find 3 or 4 of them in the county. So he had to do a little bit of back checking. And he found, yes, he has a payroll of 8. But, 4 or 5 of those doctors, one was operating in another county, private, another one was in Nairobi. But the national government has no way to monitor where the government, where the doctors are. So there was a lot of impunity in terms of national government appointments. I'll speak a little bit about that. When we had this prolonged doctor strike, which interestingly was led by Dr. Oluga as chair of the doctors union, and he's now taken a position at the Metropolitan, they have an illegally grabbed, because the president is on national government illegally grabbed, but they've created this body that is, is founded on an illegal premise. And so without pointing out and attributing it to him, I would say in terms of mindset, there's a demonstration of a mindset to decentralize. During the prolonged doctor strike, the county governments, when negotiating with the union, said, we recognize some of the counties are mismanaging health personnel because they are hiring on nepotism. And so we are not getting the quality we need. But we concede to having a county level health management body, so that we stop hiring health personnel on a county by county basis. We do it on the power still remains with counties, but it can then be centered into a body that's got a national scope, but answerable to the governors. Now, this was a kind of midway of meeting, resolving the problem that the union was complaining about, but doing it within a devolution framework. Unfortunately, or despite that, the BBI then proceeds to say they're going to set up a national commission to re-centralize health. Now, COVID tells us that isn't so. That will not help us. The last thing I'll say is this. If you look at Ghana's health facilities, the private sector gives the best healthcare. And that's because government invests in that. We have the Big Four agenda, one of which is universal healthcare. And the experts have told the president, there is no universal healthcare that you can have if you do not invest in primary healthcare. Because universal healthcare or universal health cover works when you have, you only refer the very needy cases. You must deal with the basic ailments and basic diseases at level 1, level 2, maybe up to county. Because it is very expensive to treat somebody at Kenyatta National Hospital. Right now, the money goes into medical equipment illegally. Counties are paying, this 40 billion wage bill every year for an odious debt, a corrupt debt that's being scrutinized, and I'm sure, I hope the perpetrators will be brought to book, but then a lot of money has gone down the drain. So instead of investing where the money needs to go, national government has been investing in tenders that don't make sense. So this is what COVID has exposed. And so we need really to say, we need to be very scared as Kenyans and say, we have a government that goes through a budget process and then puts money in very irresponsible places and borrows money at a very high cost and then places it in projects that then don't bear fruit. And by doing this, they've actually weakened our health system. What are we going to do about the lack of political leadership? And what are we going to do about ensuring the resources go where they meet the needs of the citizens? A human rights-based approach based on accountability and transparency. Joe, is this sound too much?
No, it's fine. So
it's come out. So I'm trying to tell it.
No, it's fine. So then quick question. And why is it that then the national government has been stifling devolution?
It's philosophical and also economic. It's philosophical because I believe there are people, well-meaning people. There are some well-meaning people who really don't think, devolved government can work. In the same way, if you recall, you were younger then, but you're very well read, so you would know this. During the constitution review discussion, there was a lot of fear-mongering around devolution. And Moi started in the 90s when he would say, ugatuzi italeta, that will bring strife and all of that. And he warned Kenyans.
Precisely, and Jomo Kenyatta in the 60s with the Majimbo constitution, right?
Right. They had, the fear that Kenya would go, into civil war the way Nigeria did. And that was used really as an excuse and an example to roll back. But from the very outset, it's a philosophical mindset. And I think it's very majoritarian. And it's really about, well, we have the numbers. So we need to rule by numbers. And others need to then come in and fit into our frame. Whereas you'll find that a devolved mindset is a very kind of inclusive mindset. You'd find the smaller tribes would prefer to be under a devolved framework, because then the power is shared, and it's not shared based on the size of the ethnic community. So devolution is a threat to majoritarianism. Majoritarianism is very important for the economic interests of the elite. So if you're looking at the first family doesn't have time to go negotiating with 47 county governments to get permissions for its various mega projects. It would rather talk to the national government, make sure they put a director there and a CS there who is very pliable. So really, majoritarianism, authoritarianism are really at the heart of the philosophical really disdain and rejection of devolution. And then, of course, that links up into corruption, because, for instance, when you look at the health sector again, there's been a lot of corruption around procurements of pharmaceuticals. And so that's why you see this really huge tussle around why can't counties procure their own pharmaceuticals? And the issue here is that there's corruption at the county level. There's corruption at the national level. So we don't want to say, well, let it go to counties and be stolen. But properly speaking, functions should transfer to county governments, and then the accountability mechanisms be put in place. So devolution in this country, yes, has, the history has been one of centralization. And I hope and believe that despite its weaknesses, devolution has done enough so that Kenyans can come up and defend it against this particular administration, because the loss of Nairobi, and it's not a loss, actually, I call it a temporary setback, is an indication of how things can continue to go if we take it lying down. So we need devolved government, we need investments that come down to the lowest level. But that is not, we have an administration that has refused to see that reality. And they're, if you look at the structure of the universal healthcare, it's very top down. So yes, it's a good scheme, but in the way it's being implemented, it's very top down. And I remember Dr. Mutaha Kangu, devolution expert and advocate and champion, saying, the president needs to understand that he can come up with a project and a scheme, be the face of it, and still work with counties. And as long as counties perform well, he also shines. But the idea that it has to be top down and at the expense of the county governments, that mindset is, there's a small cabal advising, sitting in State House, that is back in the 90s, where they had autocratic, absolute authority. And so what does it tell us? It tells us that we changed the constitution, but we still haven't dealt with the issue of elite capture. And this is what AFRICOG were telling us in the state capture report that Washira Maina wrote, and put out very well. We have created a lot of a big architecture for governance, for equitable governance, accountable governance, but then we have state operatives who are repurposing these institutions for private gain. So we have to get back to the basics of the struggle. And COVID is telling us we have to go back to basics. We can't keep saying, let's change this, tinker here. No. If we had had a major infection of COVID, Joe, we don't know where you and I would be, because we don't have the ventilators. Right. And it's a very, the death toll would have been horrendous, and the rates of infection would have been horrendous. In fact, Kenya can't afford to shut down because of the level of inequality. And again, this inequality, we talk about 83% in informal trade, in informal sector. What kind of a country calls itself middle income with those kind of statistics? And this, I think one of the defining parameters in our development is land. Every country has its defining, defining parameter. For us, it's land. And I think we thought we passed the constitution, Domo report, TJRC, government doesn't like them, but we'll do other things. But it seems like we have to get back to those basics. And we have to change our development approach. We have to go back to those basics and redress those structural inequalities, and refuse to accept that there are people who, by virtue of where and how you're born, you will remain hand to mouth. That is not development. And that's really, we say what, a recipe for violent uprising thereafter. It's immoral. And for a predominantly religious country, it's really very hypocritical that Kenyans will continue to countenance this, and just, especially us middle class, professional class, we're like thinking about our day, about our immediate survival. But COVID has shown us, you could have your very fancy setup, but when those hospital beds and ventilators are not there, your money won't get you that access unless you have political leverage. So I think we need devolution. We need to defend it. But beyond that, we need to really talk about our development philosophy. Go back to our first development paper, the African Socialism. What was it trying to tell us? Why did it work in South Korea? Because South Korea, came to Kenya, said, wow, that's a very good development approach. We're going to borrow it. What did they do that we didn't do? Back to basics, and stop pretending that it's okay, that we are fighting for political power in 2020. No, we are fighting, I think, for our survival. Other countries are taking us over. Kenyans, we've been very arrogant because we think we are the center of things and everyone wants to come to Kenya, but we are going to lose that, because you can't continue our economic growth with the failures of governance, with the levels of inequality, lack of respect of human rights. So we are going to lose that in another 10 years. Now COVID makes you very wary of making those kind of predictions, because they're saying there'll be another virus, another outbreak coming. But in another 10 years, we will be the cautionary story. Look at what Kenya did. They were up there. They were a major international hub, and they squandered it on bad governance.
Right. Yeah, speaking of back to basics, civil society has been at the center and also at the periphery of coronavirus. For a long time, people have been speaking about civil society as a donor arm and foreign influence to Kenyan and African politics. But now, with moving forward post-corona, what kind of models does civil society need to embrace to be, one, civically and focus on the people, but also what kind of principles that needs to also embrace and also champion for it to have buy-in from the people, and it not to seem like it's this apparatus for foreign influence in Africa?
Yeah, that's a good question. There's two parts to that. Of course, government has been very instrumental in demonizing civil society. But of course, civil society has also played its own role. Civil society in Kenya is funded primarily by foreign donors. And what has happened is that over time, civil society implement projects based on foreign donor imperatives. And foreign donors have also over time become very wary of pushing the democratic discourse. So it was very straightforward in the 90s. It was Moi versus democracy versus, basic civic rights. That was a very clear dichotomy, and development partners knew where they stood on that. Kibaki's time also, very straightforward. Huge democratic space, civil society was around the table. Now with this administration, it's different. This administration has pushed civil society away from the table, scattered civil society, and development partners who continue to support have also struggled in how to support. So your question is very pertinent. What do we do as civil society? We have to, much as we're saying, government, we need a different way to do things. I think we need a different way to do things. We need to find, and we need to shape donor perspectives in terms of funding. We need to create partnerships with communities and empower communities. So we also need to be very proactive and stop being docile. There's a criticism of civil society as really, they become very professionalized and it's really just careers and jobs. It's not bad to be professionals. It's not bad to have civil society institutions that retain competent staff over a long time, but it's our strategy and it's our philosophical approach. So I think to an extent we are suffering the same lack of philosophy that is, that the country has lost, and this is why we are running, really going afloat, because we know human rights, civic rights, but there's a larger question that there's an elephant in the room that we feel very overwhelmed. And I think we need to establish partnerships with academia, like-minded. I think there's a divide, Joe. There's a divide of people who see a problem, and there's a divide of people who don't see a problem. And those who see a problem and see the need for a new way have to look for like-minded people in business, in religious, because something happened after the 2013 207 especially, again highlighted in 2013, the synergy between civil society and religious faith-based organizations. There was, I think, a loss of faith and a separation. So a lot of civil society do not trust faith-based organizations because they feel they've stopped agitating for the interests of the common person. This has isolated civil society against a very hegemonic government. So we have to really now hunker down, get back to the drawing board and strategize. How do we get rid of this hegemony? And it is a true hegemony. And it is beating us on the funding side, it's beating us on the right side. Demonstrations, the right of assembly has all but been curtailed in Nairobi by this autocratic administration. So yes, civil society needs to strategize. We are working under very difficult circumstances, and I think we need to convince Kenyans. I think it's a philosophical. The first thing is just to convince Kenyans that we cannot continue like this, and recruit enough people into that movement, and stop getting sucked into the politics of the day, because that politics of the day is not taking us anywhere. So I don't think it's just about corruption. It's something much more fundamental than that. And I think civil society needs to provide a blueprint for the country, so that we can, really be at the forefront of the revolution we need. The revolution to remove hegemony, the revolution to remove this business type led kind of
neoliberal
failed model of large infrastructure, trickle-down economics. It is not working. And the thing is, in the 90s, after the ravages of the structural adjustment programs, that thinking, if you look at the African Charter for Public Participation, 1992 in Addis Ababa, African governments were committing themselves to this. They were saying development is about the people, for the people, with the people. And our continent cannot liberate itself without the people. But then these are the pronouncements that governments make, and then there is no follow through. So I would say our countries are very young in their democratic trajectory. And so these reversals, are inevitable. So we must, re-energize our efforts and think about, become more strategic, look for different ways to do what we need to do. This kind of platform, alternative media, is fantastic. We need to capitalize on that. But I believe this is just the beginning. We need to get very innovative. I think what we shouldn't do is get defeated. We shouldn't cow down. We shouldn't believe the hype, the negative kind of propaganda that forces us into retreat.
Wanjiru, on that very powerful note, I'd like to end this conversation here. Thank you so much for being on the Elephant Life After Corona.
Thank you so much, Joe. Thanks for the time. You're doing great work. We're very proud of you guys.
Thank you so much.